For millions of people around the world, living with type 1 diabetes is a constant daily battle. This is an autoimmune disease, which means the body's own defense system gets confused and attacks its own cells. In this case, the immune system targets and destroys the special cells in the pancreas called islet cells. These tiny cell clusters are responsible for a very important job producing insulin. Insulin is a hormone that acts like a key, unlocking our body cells to let sugar or glucose enter and be used for energy. Without this key, sugar builds up in the bloodstream, leading to serious health problems over time. This lack of insulin production creates a life-threatening situation. People with type 1 diabetes must carefully manage their blood sugar levels every single day. This often involves multiple finger pricks to check their glucose and several injections of insulin to keep those levels in a safe range. Imagine having to perform this delicate balancing act for your entire life, knowing that a mistake could have severe consequences. The condition affects about 9.5 million people globally, turning what should be a simple biological process into a complex and demanding daily routine that requires constant vigilance and medical support. The long-term effects of high blood sugar can be devastating. Over many years, elevated glucose levels can damage blood vessels and nerves throughout the body. This can lead to a host of complications, including heart disease, stroke, kidney failure, nerve damage, and even blindness. The constant need for monitoring and medication places a significant burden not just on the individual's health, but also on their quality of life. The search for a true cure, one that eliminates the need for daily insulin injections and constant worry, has been a primary goal for medical researchers for decades. Finding a way to restore the body's natural ability to make insulin is the ultimate dream for patients and doctors alike. A cure would mean freedom from the relentless cycle of blood sugar checks and insulin shots. It would lift the heavy weight of potential long-term complications and allow individuals to live without the constant shadow of their condition. For a long time, this has seemed like a distant hope. However, recent scientific advances are bringing us closer than ever to turning this dream into a reality, offering a new chapter for those living with this challenging disease. For years, scientists have understood that a potential cure for type 1 diabetes could involve transplanting healthy, insulin-producing islet cells from a donor. The idea is simple: replace the cells that the immune system destroyed with new ones that can do the job. This procedure has been performed, and it can be successful in restoring insulin production. However, it comes with a major, unavoidable trade-off. The patient's immune system, which attacked its own cells in the first place, is just as likely to see these new donor cells as foreign invaders and launch an attack to destroy them as well. To prevent this rejection, patients who receive a standard islet cell transplant must take powerful drugs called immunosuppressants. These medications work by tamping down the entire immune system, making it less aggressive and less likely to attack the newly transplanted cells. While this protects the precious new islet cells, it leaves the patient in a vulnerable state. A weakened immune system means the body has a much harder time fighting off everyday infections, from the common cold to more serious bacteria and viruses. This can make a simple illness a major health crisis for the patient. This need for lifelong immunosuppression creates a difficult choice for patients. Do they trade the daily burden of insulin injections for the constant risk of serious infections? For many, this is not an ideal solution. The side effects of the drugs can be significant, and the risk of getting sick is a constant worry. This fundamental problem of immune rejection is why islet cell transplantation has not become a widespread standard cure for type 1 diabetes. Scientists knew they needed to find a way to protect the transplanted cells without having to shut down the patient's entire immune defense system. The challenge was to make the donor cells invisible to the recipient's immune system. If the cells could be camouflaged, they could be transplanted without triggering an attack. This would eliminate the need for the dangerous immunosuppressant drugs. For a long time, figuring out how to create this stealth effect at a cellular level seemed like science fiction. Researchers needed a tool precise enough to edit the very identity of the donor cells, essentially giving them a passport that would allow them to live and work in their new home without being identified as foreign. The breakthrough that scientists were waiting for came in the form of a powerful gene editing tool known as CRISPR. You can think of CRISPR as a pair of tiny molecular scissors that can be programmed to find a specific gene within a cell's DNA and make a precise cut or change. This technology has opened up incredible possibilities in medicine, allowing researchers to correct genetic defects or, in this case, to modify cells to give them new properties. For the diabetes treatment, a team of scientists in Sweden and the United States used CRISPR to engineer donor islet cells to become hypoimmune, or almost invisible to the immune system. The process involved making 3 crucial genetic edits to the cells from a 60-year-old donor. The first 2 edits were designed to lower the levels of proteins on the cell's surface called HLA proteins. These proteins are like a name tag that the immune system reads to determine if a cell belongs to the body or if it is a foreign invader. By reducing these name tags, the scientists made it much harder for the immune system to recognize the donor cells as being different. This was the first layer of the disguise, helping the cells blend in. The third edit was just as clever. The scientists used CRISPR to boost the production of another protein called CD47. This protein sends a powerful "don't eat me" signal to the immune system's attack cells. Even if an immune cell did happen to notice the transplanted islet cell, the strong CD47 signal would act as a universal peace treaty, telling the immune cell to leave it alone and move on. By combining these 3 edits, turning down the "I'm foreign" signals and turning up the "don't eat me" signal, the researchers created a set of islet cells that were fully cloaked from immune attack. This triple-edited cell was the key to unlocking a new kind of transplant. For the first time, it seemed possible to give a patient insulin-producing cells without needing to suppress their entire immune system. The edited cells were designed to protect themselves. This elegant solution directly addresses the biggest obstacle that has held back transplantation as a cure for type 1 diabetes. It represents a monumental leap forward, moving from a strategy of weakening the patient's defenses to a strategy of strengthening the transplanted cell's own ability to survive. In a groundbreaking study published in August of 2025, this new therapy was put to the test. A 42-year-old man who had lived with type 1 diabetes for 37 years and had no natural insulin production became the first person to receive these gene-edited cells. Doctors administered a relatively low dose of the engineered cells through a series of 17 small injections into his forearm. This was a proof-of-concept trial, meaning the main goals were to see if the procedure was safe and if the cells could survive without being rejected by the man's immune system. The results were truly remarkable. 12 weeks after the treatment, tests confirmed that the man was producing his own insulin for the first time in decades. The presence of a substance called C-peptide in his blood, which is only made when the body produces its own insulin, proved that the transplanted cells were alive and working. Most importantly, there were no signs of an immune attack against the fully edited cells, and the patient did not need to take any immunosuppressive drugs. To confirm the CRISPR edits were essential, the researchers also transplanted some partially edited cells, which the man's immune system quickly found and destroyed. While this initial success is a historic milestone, it is important to note that the patient is not yet fully cured. Because he received a low dose of cells for this safety trial, he still needs to take some daily insulin to manage his blood sugar completely. However, the study has achieved its primary goal. It has proven that transplanting these hypoimmune cells is safe, and that they can successfully evade the immune system without the need for dangerous drugs. This opens the door to a future where a larger dose of these cells could provide a functional cure. This breakthrough offers immense hope for the future of diabetes treatment. It lays the groundwork for a therapy that could one day free people from the daily burden of insulin injections and the constant fear of long-term complications. Future studies will focus on determining the optimal dose of cells needed to achieve full insulin independence and confirming these results in more patients. If successful, this CRISPR-based approach could transform the lives of millions, turning what was once a lifelong chronic disease into a condition that can be cured with a single, revolutionary treatment.